So this series of presentations will focus on conditions that affect mobility or musculoskeletal and neuromuscular disorders of the growing infant and child. So there's going to be a wide array of topics covered, and it's pretty hefty, so let's jump right in. This section is going to focus on the pediatric considerations of the musculoskeletal system, causes of immobility, the physiologic, psychological, and behavioral impacts of immobility, including impact on the family and nursing management and considerations. So bones are the framework for the growing body, and in infants and children, it is immature. And we've discovered a lot of things are, right? Growth is genetically determined, but potential can only be attained if there's adequate nutrition, physical activity, and good general health. Now, we've talked about how rapid growth is in the first 2 years, slowing to a relatively constant rate except for brief spurts. Now, children and adolescents will form bone faster than they lose bone, so they continue to get denser until they reach peak bone mass. And this happens between the ages of about 18 and 25. So welcome, you all, to your peak bone density years. Another thing to consider is that deformities in the musculoskeletal system can lead to secondary problems such as chronic pain or balance, mobility, and respiratory issues. So what are some causes of immobility? There can be a variety of reasons someone has or develops issues with mobility, and this includes having a disability, illness, or injury that limits their mobility. So some of the most frequent reasons include congenital defects like spina bifida, neuromuscular conditions such as muscular dystrophy, prolonged mechanical ventilation and sedation, and infections or injuries that impair the integumentary systems like severe burns, musculoskeletal like complex fractures, and neurological systems like spinal cord injuries. We know that immobilization can have serious consequences. So what is the impact of immobility on our bodies? We know that children like to be mobile. They are constantly moving. And so when they are immobile, it can have serious consequences for their physical, social, psychological, and emotional well-being, which I'll get into more detail in the next few slides. When children are ill, they're usually content being quiet and not moving as much, which is why I say that I like the spunky toddler, not the lethargic toddler in the hospital, right? They will instinctively reduce their activity in times of illness. But it's children that are forced to remain inactive because of physical limitations that may display some of these effects of restricted movements. Inactivity can lead to a decrease in the functional capabilities of the whole body and can delay a child from meeting their appropriate milestones. The major physiologic consequences of immobilization are significant loss of muscle strength and endurance, muscle mass atrophy, and loss of joint mobility leading to contracture. Now, inactive muscle loses their strength at a rate of about 3% per day, so it could take weeks or months for appropriate function to return, hence why passive or active range of motion exercises are so important. Muscles that are inactive can stretch or lose tone by excessive strain put on weakened muscles from things like tight bed covers or poor body position. It's important to establish that range of motion within 3 to 7 days, or contractures will start to develop. And you'll see them, in like abnormal hip flexion, knee flexion, plantar flexion of the feet, and shoulder stiffness. I see a lot on peds in the wrists and feet. For skeletal system, daily stresses on bone from motion and weight bearing will normally allow the balance between bone formation, your osteoblastic activity, and bone reabsorption, osteoclastic activity. When diminished, bone formation ceases and destruction will continue. So you'll have demineralization or osteopenia, which makes the skeletal structures more prone to pathologic fractures, and it also increases calcium ion concentration in the blood, or hypercalcemia, which will have some cascading effects we'll talk about in a little bit. Immobility also impacts the cardiac system. 3 major consequences on the heart are orthostatic intolerance, increased workload, and thrombus formation. So normally when you are mobile, the muscles contract, causing pressure on those peripheral veins, like in your feet and your legs, that cause the venous valves to close and assist in returning the blood to the heart when in the upright position. When you are immobile, this is dormant, and blood will pool in those dependent areas, reducing blood flow to the trunk and the brain. This reflex stimulation is impaired and causes interference with venous return, which we will then see as pallor, sweating, and fainting. Being horizontal also decreases gravity's effect on extremities, which leads to increased venous return, resulting in increased cardiac output and stroke volume, and increases in heart rate. Now, over time, the body will compensate, and we will see the heart rate and blood pressure normalize. And also without muscle contraction, we can have the development of something called Virchow's triad, which it includes three things: hypercoagulability of the blood, stasis of flow, and endothelial injury of the blood vessels. Now, these three things together, these three factors, contribute to the formation of blood clots or thrombosis. Okay, that was a lot. Now, there's a whole lot more that immobilization can affect. I feel like if it can affect it, it probably will. Respiratory system is going to have to work harder. We'll see more secretion build up since coughing is much more difficult when supine. Bowel motility will decrease, as well as increased risk of aspiration due to positioning and potential emesis, right? You'll have slower digestion. Stool can be more difficult to pass without gravity assisting, and you'll have slowed peristalsis. Our kidneys are meant to work when we're upright. So when we are no longer in that position, the ureters will have a lot more trouble. Fully emptying the bladder can also be difficult due to being in that horizontal position. And then if we call back to that hypercalcemia from the demineralization of the bones, we may see more kidney stone formation. Lastly, we are also going to have effects on metabolism, which can affect all body systems. They may be fatigued, have poor appetite, have GI symptoms from the hypercalcemia as well. And last but not least, the integumentary system. Immobility plays a role in skin breakdown. Okay, circulation is reduced with immobility, and these patients are at risk for moisture, friction, shear, and pressure injuries. These breakdowns will often occur on bony prominences like the sacrum, elbows, heels, the occiput, or the back of the head. So how do we combat this? Well, we turn these patients every 2 hours and we do skin checks during care. Some of you may have had total care patients on peds and been a part of this, or maybe have also seen those patients with positioning supports to help. We have gel pads for the elbows or the heels, pillows between the legs, things like that. There is also increased risk for ischemia and damage, which can cause pressure ulcers. So immobility also has psychological, social, and emotional effects. Physical activity, I don't think a single system has been left out at this point. Physical activity is an integral part of childhood and everyday life, and it's essential for growth and development. Physical activity for kids serves as a means of communication, expression, learning, understanding of their world. Immobility, on the other hand, can lead to diminished stimuli, which narrows the amount of touch, sight, hearing, taste, and smell that they may experience. And then this can lead to feelings of isolation and boredom, almost like feeling that they're forgotten. A patient I had that was previously healthy had an undiagnosed renal failure and ended up having a stroke from severe hypertension, and this resulted in left-sided weakness. And this patient was 9 when this happened, so they knew what they were able to do prior to having the stroke. So they had this altered perception of things that they could do in the environment around them. Initially working with this patient, it involved a lot of helping them realize the limitations that they now had. And while it's important to, yes, focus on their abilities and what they can do, it is also important that they understand that, like, yeah, you do need help getting out of bed. Initially, this was a hard concept because they were so used to being able to use both sides equally, and it's easy to forget. And so now you have a child trying to get up out of bed without assistance with left-sided weakness, and so now they're a fall risk, right? Other effects would include feelings of frustration or helplessness, depression or anger, some regression. Keep in mind these will vary, as all things do, with age and development. So depending on if it's a school-age child or a teenager, you will definitely see behaviors based on their developmental age and their chronological age. So behavioral changes are also linked with psychosocial a bit and can include things like increased anxiety, which can present as restlessness, okay? They might have difficulty problem solving or with concentration. The monotony of being immobile could have effects as well. I was on bed rest for 4 months during pregnancy, and let me tell you, it was rough. And while I didn't forget how to do things, I definitely wasn't as willing or able to do them when I was finally upright and moving around again. There was a lot of loss of purpose, and even making somewhat easy decisions like what to eat for breakfast just became a task that took longer than it had prior, most likely because I had nothing else to do but choose breakfast. And being within 4 walls constantly is really, really hard. And a lot of you may have experienced this a bit during the pandemic lockdown, right? I think that we have a lot more empathy and ability to kind of understand what it feels like to be stuck somewhere since 2020. You eventually run out of things to do in your small space, and some people cope better with it than others, and the same goes for kids. So whether brief or extended, immobility can disrupt the family. It will tax resources. It will tax their coping abilities. We may need case management or resources at home, such as home health nursing. Families may need support and home care assistance with coping skills or coping with the child's behavior in an altered body condition. They may need assistance with other children in the home, or those other children may end up feeling neglected. You may see issues with acceptance of their altered body image, maybe feelings of guilt that their child is no longer able to move like they used to be able to, especially if it may have been due to some type of accident while under their care. So for nursing care, we will always do a physical assessment, always. Now think about what are going to be some of your important assessments. Okay, we need to assess pain and provide pain management, assessment on not only the injured or a mobile part, but also in those other areas like we talked about that can be affected by immobility. So the circulatory system, renal, respiratory, muscular, GI, everything, right? We need to help prevent injury and complications by turning at least every 2 hours, helping them get out of bed if able, reposition, do thorough skin assessments, range of motion exercises, encourage good nutrition, monitor I's and O's, help with incentive spirometers, deep breathing, making sure they're hydrated. This is like all of first semester, like foundations nursing school skills, right? Your big checkoff list, right? We should encourage active and passive range of motion, help with the use of walkers and crutches, wheelchairs, braces. We want to make sure that physical therapy and occupational therapy consults are in. And then as far as skin assessments go, we'll be using that Braden Q scale to assess their skin, and you should recognize this from clinical. It's in the flow sheet. We are going to help them participate in self-care as able, and even something as simple as giving them choices for meals or what to wear, maybe develop a schedule for them. And then, of course, support the family. All right, so this ends this portion of the presentation. We're going to continue on with casts and traction next.